Hello, my name is Kim Gallen. I'm a health informatics consultant. I'm here today to present an evaluation plan for a clinical decision support system. This clinical decision support system is a drug alerting, a drug interaction system, and it's been giving a local health organization a significant amount of false positives. We're here today to evaluate this system and determine what might be the issue. Before we talk about actually evaluating, we should start off with a definition, a common definition that will ground us in a set of common terms. A clinical decision support system, otherwise known as CDSS, is a computer program designed to help professionals make clinical decisions. They're used for the following purposes. They provide customized assessments or advice based on sets of patient-specific data. They suggest differential diagnoses. They offer advice about additional tests and examinations. In addition, they provide treatment advice like therapy, surgery, and other medical procedures. They allow pharmacy systems to alert providers to possible drug interactions or incorrect drug dosages. And then finally, they're designed to remind the physician of diagnoses or problems that might be overlooked. Some benefits of using a CDS include it creates and helps create consistency in care decisions. It helps to manage quality health initiatives. It offers doctors and other clinicians, timely patient-specific information. It allows clinicians to obtain a fuller picture of the patient's overall health condition. It helps to create cost impact. What are the costs of healthcare? And finally, it reduces medication errors. Some CDS tools that are available to clinicians include computerized physician order entry, also known as CPOE, that automates medication ordering. There's Visual DX that enhances diagnosis accuracy by allowing clinicians to look at the way conditions show up on the skin. There's Diagnosaurus, which is a reference tool that contains over 1,000 different diagnoses. There's MCIN, which is a computer-based consultancy that allows physicians to diagnose bacterial infections. And then there's QMR, which summarizes information in medical literature. These are just some of the many CDSS tools that are available to clinicians. Now let's think about this evaluation plan. Before we can think about an effective evaluation plan, we need to identify the stakeholders. In this instance, the stakeholders are end users, which can be physicians, nurses, patients, pharm techs, and lab techs. A project manager that tracks the project that includes scheduling, productive use of resources, and budgeting. The product owner, which is focused on the features of the CDSS and the cost. The product developer that actually develops the CDSS, and the overall system architect who integrates the CDSS into the entire system. Now, our key evaluation questions are going to be how accurate or not is the CDSS, and what is its role in clinical efficacy, and what is the data available to measure that effectiveness. The other evaluation question is how does the CDSS impact patients and other aspects of the healthcare environment? These key questions will allow us to actually evaluate the CDSS to determine why it is giving false positives to clinicians. Now, the areas of prioritization is going to be, we're going to evaluate the user's needs. We're going to look at top management support. What is the support that's being provided to management? What's the commitment of the expert in this kit situation in terms of the product developer and the product owner? What are the integration of other issues into this issue with the false positives? Is it about an electronic health record that is actually at the base of the problem? Is it a human-computer interface issue? So we're going to evaluate that. Is it the incorporation of a domain of knowledge? Is it the knowledge about drug interactions or the types of drug allergy issues? And then finally, we're going to consider the social and organizational context of the entire CDSS. These are our areas of prioritization. Now, our theoretical approaches and models of evaluation, it's important to talk about the different theories before we decide and demonstrate why we've chosen one. So let's look at these four theories. The theories are change theory, systems theory, learning theory, and information theory. Change theory rejects previous knowledge and replaces it with new information. Systems theory is the interaction of components that together have the characteristics of an organized whole. And learning theory is receiving and processing information. And finally, information theory is theory that looks at communication and looks at the information source. It looks at the transmitter, the information pipes, the receivers of the information, and determines if that information is being communicated effectively. We have chosen to go with information theory. We've chosen information theory because we believe that the source of some of this false positives may be about the communication of the information. And we'd like to be able to look at the transmittal of this information and look at the channels and the receivers in order to determine what might be the issue. Now, our evaluation is management focused. We'll be assessing the impact and the effect of the CDS in the overall organization. We believe that it will generate insights into related workflow, disruption, productivity impact, and process changings. What we're hoping to find we're hoping our findings will be used to refine and modify the workflow, identify bottlenecks or disruptions in services, highlight the newly gained efficiencies that we will hopefully be able to develop through the findings. So our findings, we believe, will help increase the efficacy of the drug alerting system. Now, in essence, we're going to be doing a summative evaluation, which assesses the outcomes and effectiveness overall. We're going to focus on clinical outcomes and try to determine how this false alerting system is impacting the clinician's ability to provide care. We believe that we can do that by observational studies. So we're going to take a set of case series. We'll look at a set of cases of where the alert system is giving a false positive alert. Then we'll look at the cost-benefit analysis to see what type of impact this is creating financially in terms of time and overall morale. And then we'll do a meta-analysis looking at the overall system. Again, we're going to be using information theory and look at the transmittal of that information and how that impacts the overall system of that local health organization. We believe that this will be incredibly important in determining what might be at the basis of the false allergy. And so false alerting positive system and the drug alerting system. It's important to talk about the challenges that might come up in evaluating this CDSS. Let's look at first how the CDS is integrated into the EHR. Now, normally that is a benefit, right? It allows for interoperability. But when you're evaluating, it's important to disaggregate the CDSS from the EHR, and that may be difficult and challenging depending on how tightly they're bound up together. We're also concerned about contamination, where some clinicians are not getting a false positive alert, and they may be contaminated and being mixed in with other clinicians who are constantly getting false positive alerts. So we're trying to determine and get data that will help us disaggregate from user error to actually something being wrong with the CDSS. So we run the risk of contamination. We're going to need special analytics to actually analyze the data, so that's going to be challenging. We need to make sure that CDS is used regularly enough to give us enough case series to actually evaluate. And then finally, we need permission needed if we're going to do any randomized controlled trials or use other information that could be confidential or violate any HIPAA policies or rules. So we believe that this is going to be an effective evaluation for this CDS, for the local health organization, and it will demonstrate why the rate of false positives are so high. Thank you for your time and for allowing me to present our evaluation plan.